Hi everybody, welcome to another episode of Rapping with the Rep. I'm State Representative Ken Gordon, and I'm here and very honored that we have State Senator Cindy Friedman back with us, a frequent visitor here on Rapping with the Rep. Welcome back.
Thanks, Ken. It's nice to be here.
Thank you. And we're here to talk about the upcoming legislative session. Committee assignments just came out, and just prior to that, we filed the bills reflecting on the priorities that we have going forward. So we want to talk to you folks about what we see coming up. Senator Friedman represents Burlington, as do I. And Senator Friedman represents Lexington. I represent a part of Lexington. And so we have a lot of work that we do together. Plus, we serve together on an important commission that we can talk about as well. Our general policies align. And so I'm looking forward to this conversation. Let's start off with the committee assignments. They came out in the last 2 weeks on the Senate side. Senator Friedman, you'll be returning as chair of mental health and substance abuse, right?
No, healthcare financing.
Healthcare financing, I'm sorry.
It was a couple sessions ago, but
Okay.
yeah, it's hard to keep track of it.
Let's talk about that. Tell me about it.
So yeah, I'm the returning Senate chair of healthcare financing. So we get all the bills that have to do with healthcare. Often they go to other committees first and then come to our committee. And also I'm the vice chair of Senate Ways and Means. So I look in the Ways and Means position, I spend a certain amount of time looking at the healthcare pieces of the budget.
Yeah, so healthcare finance, let's start with that, because that legislation is so important because our whole system has been funded in a way that is troublesome to community hospitals. You know, healthcare is expensive.
Yeah. It's actually an equal opportunity problem. So it's not only for our community hospitals, but it's for our providers. It's also, most importantly, for our residents. It's just becoming inaccessible and unaffordable. And we have a lot of work to do, especially coming out of the pandemic, to try to address the issues of affordability and accessibility, especially in our minority and rural communities. They've really been hit hard. The clinicians are leaving because the work is just, they spend more time on administrivia, that we like to say, than they do on seeing patients. And that and the confluence of private equity and for-profit companies coming in to the healthcare space really make it hard for providers and hospitals, and our insurers are having trouble keeping premiums down. So we've got a lot of work to do, and we've been looking at that over the past 4 years.
Right, these are priorities we looked into when I first started in the legislature 10 years ago. We did it again, we're doing it now, because these are very difficult problems. If the fix was easy, we would have done it by now.
We would have done it, right.
Yeah.
Yep.
As Vice Chair of Ways and Means, that's very important. And a lot of our listeners might not focus in because it doesn't have a topic with a sort of an anchor to a policy topic that people think about. But
sure.
What it does is you're essentially the checkbook for the Commonwealth. And by doing that, what I mean is that we reflect our priorities into all of the competing needs that we have. And there are very important needs, and members come in with needs for their districts.
Sure.
We have statewide needs, healthcare being one of them. And you've got to balance, this is what we have and this is what we can do. It's very significant. If you talk about that.
Sure. I mean, you said it really well. It is the checkbook. We authorize all of the spending that the administration does. They can't spend money without us saying it's okay, the legislature. Healthcare is about half of our budget in total. When you add mass health and when you add all of the work we do around funding community hospitals and community behavioral health centers and community health centers. So it's about half of our budget. And so it's very significant, and it's growing because the costs are rising and because more people can't afford it, and so more people end up on Mass Health and the Connector. Those are two state programs that either provide health insurance or subsidize it. So we spend a lot of time looking at those line items that fund health care. And we have to do that at the same time while as we're worrying about education and housing and food and infrastructure. So you're right, it's a balancing act.
Yeah, and as you said, education, we're going to have some very important decisions this session, and housing. We're in a housing
Right.
crisis. The governor identified that right off the bat.
Right, and so much of healthcare is around the stability that you have in your life, right? So people who don't have housing, people who are food insecure, they have a much higher rate of health problems than people who have stability in where they live, have food on their table, live in communities where they have transportation. And so it becomes a much bigger puzzle because there's a lot, it's not just are you seeing your doctor, it's not just if you have a heart attack, is someone going to come and be able to take care of you? It's how we take care of your health before you have a heart attack and before you need to go to the emergency room. And that's really important, but it makes it more complicated because so many more factors weigh in.
Right. And I made the mistake of referencing you in the mental health space because you've been everywhere when it comes to that topic.
I've
Since
been
you
around
got to
for a
the
while.
legislature.
Yeah.
Well, doing so much. Your voice is on so many of the topics that are raised in the mental health and substance abuse area. It's been a focus for you. I appreciate that work.
Yeah.
Do you have programs that you're working on now in the coming session in that area?
We do. We're, there's many players, many actors in the healthcare space. There's the providers, of course, the clinicians, there's the hospitals, there's the insurers. We leave two big ones out when we look at healthcare costs. That's pharmaceuticals and pharmaceutical benefit managers, who are the entities that negotiate pharmacy, medicine, medical prices for an insurer, and they're kind of a middleman. They're very opaque. They are not overseen by anything, but they play a major role. You all know CVS, Express Scripts, the big players. There's about 3 of them, and Silver Scripts is another one. And so, but we have no insight or oversight of them. So they play a really important role. They add money to the costs, and we don't. So one of the bills that we're very focused on is a pharmacy and benefit manager bill that would bring oversight into the pharmaceutical industry and into the pharmacy benefit managers, so that we can use them and look at them when we're looking at the overall cost of healthcare. So I think in the healthcare space, that's a big one. Another one that we've got is a workforce bill. You hear about it all the time. People have a really hard time finding primary care physicians. They have a hard time finding clinicians that just can help them with everyday healthcare needs. We have a real serious workforce shortage. Just to give you an idea, 600 beds, mental health beds, are offline because we have nobody to staff them. And yet we have a mental health crisis.
Right. It's a terrible problem. Like you said, we can't
Yeah.
match in that way.
Right.
We've got to address it.
Right. So we really need to focus on workforce. So that's another bill that we're looking at.
As part of our mental health crisis, you and I have been working together for
Yeah.
several years now on a commission that is now implementing a plan to bring a crisis center. We're focused, I think, on the Lowell area for people who have interaction with police and in other ways need primary mental health or substance abuse treatment, and now have a place to go so that they don't end up in the criminal justice system or in an emergency room taking up beds that are needed for other purposes. Can you talk about that, where we are now?
So we are, one of the things the Commonwealth has done is it has rolled out a roadmap for mental health. So we now are much more focused on providing mental health and substance use disorder care in the communities. The Restoration Center that you and I are on with the Sheriff of Middlesex County and the head of Mass Association of Mental Health, we are now focusing on providing a place for immediate triage for people who are suffering from a mental health episode or a substance use overdose or substance overdose, where they can go, they can be brought, and they get immediate care, they get triage, they may get a bed to detox. They may meet somebody right away who can help them with their mental health issue. And so you and I have been working on that for the past 4 years, and now we have we're putting out a proposal for people to respond to, for providers to respond to, where we can provide that care. And I think we're looking around the Lowell, Lawrence area to do the pilot.
Right. We've not only now got state financing to support this effort, but we have federal financing too.
We do, yeah.
The federal government has looked at the importance of this project and has backed it.
Yeah,
And,
right,
and
yeah.
we appreciate it. That's really how important it is.
Yeah, Rep. Trahan really helped us and got us some more funding for that. So yes, you're right. And people are really focused on how to deal with these issues in a much more immediate way, and in a way where you take out the criminal justice piece, where we stop criminalizing illness and put it into the bucket it belongs, which is healthcare and services. So
Yeah.
we're really excited about that.
It's fascinating to me the way that we in Massachusetts are looking at this issue just that way. I was able to learn a lot as part of that commission as to how our police forces around the area, around the state in some cases, are realizing that these are mental health issues, that people don't wake up, they're not children and say, gee, maybe I'll end up in a substance abuse situation. No, they don't choose that.
Right.
These are illnesses, these are conditions, and we can treat that and make people better rather than have people continue to return into a criminal justice system.
Right. Yeah.
So that's important. Before we move on to our bills, as to your state representative, I'm excited to be returning as the House Chair of Public Service. This is a committee that oversees public pensions for public workers, and the civil service system. And I know this session will be focused on civil service. There are many municipalities that are frustrated with the way that it's been working. There are adjustments that we can make. We've been looking at it for several years, but I'm confident that in this session we'll be able to do somewhat of a turnaround so that municipalities that have been looking to get out can take a look at now at whether this is a system that they have more interest in, that's better for them. And so our members can go back to the municipalities and say, look at this before you decide to get out.
Yeah, that's really important, and I'm so glad that you're focusing on that, because we hear a lot from our communities and from people who are trying to get into those really important public safety jobs, the barriers that they all face around civil service. So I think it's one of those things where our residents probably don't pay much attention to, but is so important because it keeps our communities, safe and great places to live, because the right people get into those jobs.
Right. There was a time where in order to get a job in police and fire, there was a time a long time ago where it was who do you know?
Yeah.
That's why civil service came into place. And so that's why I think it's worth protecting and improving is the way to protect it, so that people have an equal opportunity to get in, and so that if things go wrong, people have an equal opportunity to have someone objective looking at their issue from outside of the municipality and trying to sort things out. So it's a program worth saving, and I'm excited to be able to get in and do that and save that. Now, let's talk about some of the legislation that we filed that we're most interested in. Senator, what's on
Well,
your
let's
priority
talk
list?
about the one that you've been working on and that I'm now co-sponsor. You're a co-sponsor in the Senate, because I think that's a great bill, the non-disclosure, or I'm sorry.
Yeah.
I call it non-disclosure.
Yeah, we call it the Defense Against
Against-
Abusive Waivers Act. I
Right.
know that's a mouthful. And you were right, I've been working on that. I'm so happy to be working on that. We were working on that together in the last session too. And now formally we're working on it as the primary sponsors of this bill. And what it does is it protects workers so that when they get to a job, when they're presented with paperwork to sign, we've all experienced that, and we designate how our taxes will work, who our beneficiaries are for insurance, things like that, very innocent things. But oftentimes they're asked to provide certain waivers of their rights. I agree that if I have a dispute that arises from this employment, that I won't have a jury, that I agree to arbitration. I agree that if I have a dispute that comes out of this workplace, I agree to go to the state where you're organized. Maybe it's Texas, maybe it's California or North Dakota. we sign it because nobody's thinking about having a dispute
Right,
somewhere
right.
down the road. We're thinking, I got a job. This is wonderful. I've been out of work, or I have a better job, something like that. And now this is a great opportunity. They just sign it. And then when that day comes where there is an issue, where they're discriminated against, for example, sexually harassed, discriminated against on the basis of race, religion, national origin, then they look at that. Then they see a lawyer. The lawyer says, let me see your employment agreement. And their lawyer may, in some cases, say, I've got some bad news. You can't bring your case here in Massachusetts. And we need to protect our workers from these agreements that the Supreme Court says they're enforceable, as if you had equal bargaining power when you signed it. And this is a bill that will protect our workers by saying any waiver that you sign over a dispute that hasn't happened yet, you can waive something if something's happened, you know what's going on.
Right.
But if it happens in the future,
Yeah.
and so thank you for your help with that.
Yeah, no, it's a great bill, and it's interesting. I was watching a movie the other night called She Said, and it was about Harvey Weinstein and Miramax, and just the amount of time, the amount of times that especially women have had to sign these waivers and lose all of their protections. It just brought home to me that that this is really important. And so many people, you don't need those waivers. I mean, you don't need them. I mean, if you're a good company and you're doing the right thing, there's a lot of protections in place. You don't need to do that. And so I think it's great to focus on it and also to do something about it.
Yeah, you mentioned non-disclosure. Part of it is some people are told they've got to waive
Right.
their right to
Right to-
talk about what happens at the
Exactly.
workplace. Now, it's one thing if there's a protection you need because there's a patent, there's a
Yeah.
formula. That's what you're trying to, that's what you
Right.
make your money on, is the formula
Right.
for what you're
Intellectual
making.
rights are,
Yeah.
very different.
Very
from-
different. The
Right.
courts will protect that.
Yeah.
But just to say that I witnessed sexual harassment at the workplace, that's something that you
Right.
don't need to be protected from. And as you said, that's really counter to anything we think about going on in
Right.
our society. And so it's those waivers, because you haven't witnessed it yet, that this would apply to. It's especially troublesome in this time when, on a national level, some states are really focused on rights that we
Right.
go the other way on. We'll protect the other way. And I'm thinking of the
Right.
Dobbs decision that is taking away women's rights to healthcare decisions. If you have an employer where you agreed to the laws of a state that may criminalize, for example, abortion care, and it may say that if you are ever involved in some criminal activity that you can lose your job, well, you've agreed to the laws of the state that may have done that. And so we need to protect our people from agreeing to such a restriction.
Yeah.
So thank you for doing that, and I'm confident. And last time it was part of the economic development bill that got into conference committee, and then unfortunately just got stalled because
Yeah.
we had a glitch with a law that created a different condition. We probably can spend a whole show talking about that.
Right. 62F.
But it got to third base,
Yeah,
essentially,
yeah.
right? 62F. It got to third base, and I'm confident it'll keep going. What are the other pieces of legislation that you might want to talk about?
Well, I think that actually you raised a point around what we did around the Dobbs decision, and really it comes down to protecting the state of Massachusetts to ensure that their laws and how we deliver health care is our decision and not the state of Texas or the state of Missouri or the state of Nebraska, that we have we maintain our state rights. And so we're going to continue to focus on that, and we're going to focus on data security, we're going to focus on privacy, we're going to focus on all of those pieces that we're seeing are being used against providers and against women, especially who are in need of abortion care. We also have a bill that is called the Full Spectrum Pregnancy Bill, which is to provide no copays and deductibles for all maternal care, for all pregnancy, prenatal, post, miscarriages, depression, all of the things that fall into the package of women and reproduction. And right now we did some work, and in some cases it's costing people $20,000 to have a child, just to have the child, to birth, and that's just outrageous. And people can't afford it, and they go into real debt because they find themselves pregnant and they carry to term, and now their insurance isn't covering all of these services that they need. So it's really time to focus on, the kids and birth and all of those things that our healthcare dollars should go to, which is healthy kids, healthy people. Let's get health in there before you get sick, and this is one of them. Let's have really good prenatal and postnatal care so that we provide real healthy resources and healthy residents.
Yeah, and that again is so important. I mean, it would be sad. It is sad if a couple says we're going to have a baby, and the first question is, can we afford this?
Right.
That shouldn't be the first question, but for many people, I think it very well may be.
Oh, absolutely. And they don't even know it when they go into it. They think, oh, I have insurance, I'm covered, I'm gonna deliver, and they have no idea of what their insurance covers and doesn't cover. And it's a real problem. And we in this country, we spend less money by probably 50 or 60, maybe 75% on primary care than in any other developed nation in the country. In most countries, developed countries, if you're up to a certain age, you pay nothing for your care. You need vaccines, you get vaccines. You have a strep throat and you're 10 years old, you go and you get that checked out. You have your primary care physician, all of that is covered. We don't question how we take care of our youngest residents. And so the kids grow up in other countries, in developed countries, with much more health security than they do here. We need to change that.
Right. And
we
that
really
makes it
do.
Right, and that's cost effective for that person's entire life.
Hugely cost
going
effective.
forward.
Right.
It comes back.
Right.
And it also goes to our idea of, do we have a right to health care? And I think that in this society we should.
We should, and we need healthy people. It works for all of us. It's not just an individual stays healthy, but you have a healthy environment, you have healthy kids, you have healthy people, you have a vibrant community, people can work, they can be productive, they can add to your communities, they can, all of these things that enable all of us to have a better life. So taking, if you want to look at it really selfishly, taking care of your neighbor is a really good idea.
It really is. And so that goes into a bill that I filed that I'd like to talk a little bit about. I co-filed with my House colleague, Rep. Adrian Madaro. It was filed on the Senate side by Jason Lewis and Sue Moran. I know that you've supported it. We call it the Common Start Bill. And it's a very similar concept, which is that right now we have a crisis in early child care. We have a crisis in preschool, access to preschool, and access to early child care. Because that family, going back to, they're excited to have a baby, right? And for the first 12 weeks, that couple can take some time if they work under paid family and medical leave.
16 weeks in the Senate per person, just saying.
There you go. But after that, unless there's, say, a family member who can provide care, the couple still now has to make a decision. Access to, right now, to paid childcare can cost thousands of dollars a month. And many families just can't afford that. The lower paid parent usually has to make the decision, do I go back to work or not? And oftentimes it's not. And if they don't want to take care of their child, that's one thing. But if they do want to continue their career, financially there's this impediment. And what will happen oftentimes it impacts women, and oftentimes what will happen is the women then returning to the workforce when the child goes to school, they're behind. They've lost 4 or 5 years in that career advancement, never to catch up. So this is important from a workforce development point of view. There are workers out there who want to work, but employers don't have access to them because of childcare. It's important from the point of view of the child, as you said about healthcare. Children who go to preschool have a measurable advantage over kids that that don't when they get to kindergarten. And that measurable advantage stays with them all the way through their education and therefore their lives.
Yeah.
So it's better for them.
I think the other thing that's really important for people to understand is in a lot of cases in Massachusetts, it's not a want or not want, it's a need. When you have the housing costs that we have in Massachusetts, you have, if you're a family, you almost have to work, right?
Right.
A single parent in Suffolk County has to make about $40 an hour to cover the cost of housing, food, and childcare. So we need workers. We need people to come to our state and stay here and work in our industries. We need them desperately. We are losing people. And one of the reasons we're losing them is because they can't afford to live here. So this bill that you are sponsoring is not, it's not just a feel-good bill. It's an absolute necessity that we figure out how to provide childcare and how to support our childcare workers so that people can work because they have to, and we need them here.
Right, and what it does do, as you said, it adds stability for childcare workers because we have such a turnover.
Yeah.
And that hurts our kids because they make so little. The workers make so little, the preschool teachers and the other workers make so little that they'll stay for a year, maybe two, and then they're off to something that will pay better.
Yeah.
And we've got to stabilize that.
Sure.
So this looks at this really as in a whole new way, which is adding stability, adding support, and moving forward because, as you said, it's important from all of these different workforce point of view. Young people are coming in. They'd like to live in Massachusetts.
They want to, right?
We have a lot to offer, and we have a vibrant economy in the sciences and high tech, but they can't because they're looking at these cost impediments, like you said, housing and childcare. It's our job to address that, and I'm excited that we are. I'll turn it over to you for another bill you might want to talk about.
Let's see. We've got a lot of. There is one bill that I'll talk about. It's a small bill, but very important. We've had a bill filed now for a while that would require when an infant under 2 dies, that there be and there's an autopsy, that autopsy also be overseen by the chief medical examiner. And this came out of a story that where a child was under 2, died. It looked as if it was a shaken baby syndrome by one of the people that was taking care of them. And the person was accused and went to court. And the defense got one of the examiners to change their mind in terms of of what they thought was the cause. And this bill just simply says, because now we found out that there can be this influence, that simply says when a child under 2 passes away for an unknown reason, that the chief medical examiner sign off on it as well. And for very strange reasons that we can't understand, the medical examiners seem to be very opposed to this. And we can't understand why, but we're going to keep pushing because we think this is, there aren't that many times that this happens. It's not a big number, but it's an incredibly important issue. And so we're going to keep pushing and try and figure out why would you be against that? So,
yeah, it makes very logical sense.
Very logical sense. So it's a small bill, but something that,
That's important. Thank you for filing that.
So I think one of the things that we're sort of saying here is we have really big issues, and we've got issues that might be smaller, but they're just as important to the people that we're dealing with. So it runs the gamut.
Yeah. And I'll finish up with a small one, which also goes back to child care. But it's important to me for a couple of reasons. First of all, it's easy. It deals
we
with,
like the easy ones.
It should be mathematically easy. It deals with people who have a child care center in their home. Home child care. Right now, our law is that you've got to have 1 adult per 5 children. So if you have 1 adult running the home child care center, you have a maximum of 5 kids. If you have 2 adults, it's a maximum of I'm sorry, I said that wrong. If you have 1 adult, it's 6 kids. If you have 2, then you can have 10 kids, which is why I made that mistake of 5. It's 1 to 6, 2 to 10. So it says round it up to 12. So you still have 1 to 6, right? And I bring that up because, first of all, it makes logical sense because we need access to childcare, right? And I'll tell you why the other reason. That this was something that came out in a discussion with a wonderful, wonderful advocate named Chris Condon. And Chris passed away just within the last month. And he is one of those advocates that you never hear about, but he's always got people in his heart.
Yeah.
And that's all he thinks about. And he'll call with his ideas about, I think I can help, and largely kids. He's just focused on his kids and his kids in his area in Worcester. He's a wonderful man.
He was an amazing person.
He really was. And I'm going to work hard for that simple concept because I'll never forget the day that he came to me and said, did you know that it's 1 to 6, 2 to 10? Well, why?
Yeah.
So we filed that. We're going to continue to work on that.
Great.
Senator Cindy Friedman, thank you very much for coming on Rapping with the Rep. It's a pleasure to have you. I look forward to having you again. Talk to the people of Burlington and Lexington about the issues that we're facing in the State House.
Thanks.
Thank you very much. Thanks everybody for tuning in. See you next time on Rapping with the Rep.